family trip to Colorado.
Sounds perfect.
Then a strange headache revealed something life-threatening.
A trip to the hospital out there.
A medical flight to Little Rock.
And brain surgery at Arkansas Neuroscience Institute.
At St. Vincent.
Where a team of experts is ready 24 hours a day, every day.
We'd have gone anywhere in the world for the best treatment.
But all we had to do was come back home.
The Arkansas Neuroscience Institute at St. Vincent.
Into Good Morning Arkansas. We are here this morning with Dr. Missy Graham from the Arkansas Allergy and Asthma Clinic. Thanks so much for being here.
Thanks for having me, Allison.
Lots of people have great questions, and that number once again is 1-866-GMA-TALK. We'll get started real quickly, and Sherry from Sherwood is on the phone. Sherry, go ahead.
Hi.
Hi, Sherry.
I wanted to know if there was anything that you offer naturally to help that you could take year-long for allergies, and what medicines are safe to take when you have high blood pressure and thyroid issues.
Well, Sherry, those are great questions, and almost all of the medications that are prescribed for allergy and asthma are very safe and don't have a lot of side effects, and they don't interfere with blood pressure medicines. The only thing that you have to be careful about is some of the over-the-counter medicines and prescription have a decongestant. So Allegra D, Claritin D, those types of medicines, that can further increase your blood pressure. As far as what there is that is available that's natural, if you're very allergic and have hay fever to pollen, allergy shots are natural, because that is all that is doing is teaching your body to not be allergic to things in nature. So that's, it's actually the pollen that's purified that's put into the allergy shot. So that's one option. There are a lot of herbal medicines and other alternative medicines available. I don't know about any of those specifically. You just have to be careful because they're not all approved by the FDA. So just make sure that they don't have anything in there that could be dangerous.
And that's a question a lot of people have about everything these days. They're looking for all natural, and I didn't know that about the shots. Some good information
natural. There was saline only. So.
All right, Tony now from Little Rock. Tony, what's your question?
Good morning.
Good morning.
I have a question. I've got a couple of signs and symptoms, and I wondered if it could be allergy related. It's no history of allergies or major illnesses, but clear nasal drainage and chest pressure. Cardiac has been ruled out, so the chest and the lungs all look good and clear, but I still feel just a chest tightness and nasal drainage just at different times of the day. I haven't been able to pinpoint anything specific as far as season change or a pet. We have a dog that, of course, loves to give sugars. So, I'm in constant contact with his face. But
well, let me just jump in and mention that anytime you have nasal symptoms and chest symptoms, there is a consideration that you could have allergy. It's very good that you've already had this checked out, because the most important thing is to always rule out other heart problems and lung problems. So if that's been ruled out and you're having drainage and chest tightness, the way that could be connected would be allergy and asthma symptoms. So you really should see your doctor, maybe an allergist specifically, since you've seen somebody, to rule those other things out, and they can hopefully get to the bottom of that.
All right, next we have Mary from Hot Springs. Good morning to you, Mary.
Good morning. Yes, I have a question. I have an 8-month-old grandson and a 5-year-old grandson, and the 8-month-old has been diagnosed with asthma and is on breathing treatments. The 5-year-old has been through allergy tests, and their doctor tells them that he's too young to determine if he has asthma. So what do we do?
Well, that is a very confusing problem that happens, because babies are too young to get the actual diagnosis the same way that an adult or an older child does. But they also can have the same signs and symptoms of asthma that still needs to be treated the same way. So there are other terms someone could use, like reactive airway disease, but that really is not changing what the problem is. I would follow the advice of your doctor. If they feel like the 8-month-old is having asthma symptoms, even if they're calling it asthma, asthma, I would still treat that because you don't want the child to have problems with their lungs as they get older. And a lot of times they outgrow it if they have asthma symptoms when they're a baby.
Mary, thanks so much for calling in. Hopefully that advice was helpful for you this morning. Thanks so much, Dr. Graham. We appreciate you for coming in. As always, there's the information. If you need more specific information or need to see a doctor over there, they're at West Markham in Little Rock.
Thank you.
Thanks. Good to see you.
Appreciate it.
Yeah, important topic this time of year for sure.